The new criteria are very easy to implement. To be honest, after the meeting, we have all been trying to implement the criteria in our clinical practice, comparing the past criteria and the new criteria. It's very easy if you accept, and to be honest, this is the case, that not every person with MS with suspected MS needs to do everything. You do what is more reasonable for each case. If in a specific moment you have difficulties accessing MRI or some specific MRI sequences, you can do CSF analysis. If there are some reasons contraindicating, or if the person does not want to do CSF analysis, then you can do more thorough MRI studies. So it's a matter of getting used to new possibilities. I mean, science and MS research are advancing, so we need to follow what's going on. We can't stick on something that stays the same. We need to make sure that, scientific advances and clinical practice go in the same direction. So here the key point is making sure that there is a set of tests that can be widely available, and then each center will implement the tests that are needed on a specific case. Of course, there will be a limited number of people with suspected of MS where a center might not be 100% sure about the final diagnosis. But honestly, this is a very little minority of people with suspected MS. And in this case, they can refer to other center who has access to other methods. But to be honest, with the previous set of criteria, we already had the same problem with some people that we were unable to make the diagnosis. Now we are adding additional tools that can improve our sensitivity and our specificity in making the diagnosis. We are aware that there is the risk of increasing complexity, but to be honest, medicine is increasing complexities in any field of medicine and any field of neurology. So I don't think this is something MS specific. What we are doing, though, is not increasing overall complexity, is increasing the number of possibilities to make the diagnosis of MS. So here it's more a matter of mix and match, whatever you need to do for each single person.